Good morning, everybody, and thank you for being at this morning's press conference. I am Senator Dalen Leach, along with Mike Fulmer, the author and prime sponsor of the recently passed, not that recent anymore, medical marijuana bill here in Pennsylvania. And as you know, after the bill was passed, a series of regulations were promulgated over time, and some of the licenses for both grow facilities, grow processor facilities, and dispensaries were awarded, and those companies are working hard to comply with a 6-month deadline to get up and running. So things are moving forward. Patients who are in need of this medicine have a profound sense of hope as we get closer and closer to the time when it's available to everybody. It is already available to hundreds of children under the law's safe harbor provisions. So this is already making a huge difference in people's lives. Now, whenever you have a competitive process to award licenses, there will always be winners and losers, and there will always be people who feel that they were wronged in some way if they did not get awarded a license, particularly in something like this where the costs of applying, the costs of putting together a consortium are quite high. So people put a lot of effort into getting these licenses, and I certainly understand a sense of disappointment when there are a finite number of licenses to be awarded. We expected people to appeal. We hoped that there wouldn't be lawsuits, but we knew that that was certainly a possibility. We tried to draft the law in such a way to address some of the problems in other states, so we limited the number of lawsuits here. But again, it's a free country. People are free to seek redress in the courts if they feel that there has been something that is improper, or they suffered an injustice. However, recently, at least one company, Keystone Relief, filed a lawsuit in which they asked, as part of their prayer for relief, that the entire program be shut down, reconfigured, and started from scratch. Now, what that would mean is that all of the facilities that are being built would stop that process. All the dispensaries, the same thing, and patients would be unable to get the medicine they need. And that is a process that we find unacceptable, and that is why we're having this press conference today. We are asking Keystone Relief specifically, but other companies who may be contemplating litigation generally, to seek whatever relief they think is appropriate, but do not attempt to shut down the entire program. It's like if there was somebody who was suing a hospital for some issue and put in their prayer for relief, let's shut down all hospitals until we resolve all of this. That would be nonsensical, it would be cruel, it would be heartless, and we're asking them not to do that. It's important to keep in mind that there are other remedies, among which, and I'm not their lawyer, or I'm not representing anyone in this, but there are other remedies. They could seek the awarding of a license. If they think that another licensee committed some act of fraud, they could ask that their license be taken away and given to them. They could seek monetary damages if they feel that they've lost money as a result of all of this. But this prayer for relief is asking that grow houses and dispensaries be shut down that Keystone Relief is not even competing with. Keep in mind, you have to apply by region. They're asking that the entire state be shut down, even in regions they are not seeking licenses in. Now, every single license applicant that I met or saw give interviews or read about, they always say the same thing. We are doing this for the patients. And I understand there's a financial reason to get involved in this, and there's nothing wrong with that. Everyone has to make a living. But everyone always said, but really at the bottom of this is concern for the patients. How can you have concern for the patients if you're asking that their medicine be taken away from them? Keep in mind, there are cancer patients, post-traumatic stress disorders, children with terrible forms of epilepsy, and many other things that they are saying do not give these people medicine. And in some cases, these people will not survive. At the very least, they're going to endure additional suffering. You know, states with a medical marijuana protocol that's up and running have, according to CNN and others, a 25% lower rate of opioid deaths than states that do not. In Pennsylvania, that's over 2,000 people a year die of opioid overdoses. Just statistically, if we follow the same 25% pattern, that would be 500 or more people a year who will die if they do not have access to this than otherwise would. I don't know how any company in good conscience, I don't know how much money there is in the world that they think they need that would make it worth denying one child or one patient access to medicine that would save their life or end their suffering. So the question is, number one, how long would this take if they shut down the whole program, started from scratch? It could take 6 months. It could take 3 years. What happens to those? We can't get it. The patients, in most cases, can't get it from any other state under federal law. What happens to those patients? Someone should ask Keystone Relief. What do they envision happening to the patients during the period of time that they want this program shut down? And what would they say to those patients? I am agnostic, and I've always been agnostic in terms of who gets licenses. I didn't weigh in. I had no power to weigh in. I didn't send a letter. Some senators sent letters in support of various applicants in their district. I did not, because of my role in getting the bill passed. I did not make a phone call. I do not care. All I want is the best applicants to get award, because I want the program to do well. And if Relief is one of the best applicants and something went wrong, more power to them. I don't care if they win their lawsuit or not. All I care about is that the program does well because we did get into it for the patients. And so we are asking publicly that this company and every company not seek relief that would harm patients. There are a couple of folks here who speak on behalf of patients far more personally and far more eloquently than I do. And so I am going to bring a couple of them up here. First, we have Angela Farrow. Angela?
Good morning, everyone. Thank you, Senator Leach, for including us today. We truly appreciate the opportunity. As many of you know, Campaign for Compassion started as a small grassroots medical cannabis advocacy group. Our only concern then, and our only concern now, is that the sick and suffering patients of Pennsylvania quickly gain safe access to medical cannabis. For those that have covered this issue, you have seen us, our family, our friends, our supporters practically live in this building for years. It has been a long and challenging journey, and it's only ever been about one thing: the patients. Today, Campaign for Compassion has questions for those seeking to halt or stall this program. Do you know how this legislation started? Do you know who this program is for? Do you know how you even have the opportunity to apply for these licenses? The answer to all these questions is the patients. The patients. The patients. If you have different answers to these questions, we ask you to please come meet with us so that we cannot just tell you about, but show you who this program is for. We urge you to reevaluate how you are proceeding. For so many patients, this program was needed to be in place years ago. Please do not delay this wait any longer. We would like to thank the Department of Medical Marijuana for tirelessly working on getting this program up and running as quickly as possible. And we want to thank our governor for his continued support. I would like to now introduce my friend and fellow Campaign for Compassion board member, Kara Salemi, so that she can tell you a little bit about the calls and the emails she has been receiving from desperate patients.
I could tell you our story again about my son Jax, his bout with a viral infection at 5 years old that led to brain damage and intractable epilepsy. I know that story so well because we live it every day. But what I really want to talk to you about today is life on the behalf of thousands of Pennsylvanians that were unable to be here to tell their story themselves. Every single day, we read painstaking details of someone's life and their loved one's desperate attempt to save it. Hundreds of emails and private messages and conversations have been sent to C4C. We've met new advocates and we've circled back with some familiar faces, and yet each story ends the same way. My wife has been fighting breast cancer that has spread to her brain and liver for over a year. I don't know what to do. She is so thin. Can you help? My daughter was born with a genetic disease and lives with a colostomy. She was diagnosed recently with colitis. She suffers daily with severe abdominal pain. She is depressed and she can't go to school. We are afraid she is suicidal. This is our last hope. Please help us. After I filled out the safe harbor paperwork, I was told that my 18-year-old son was too old for the safe harbor, even though his doctor signed off. How could this happen? Why was he forgotten? Can't you do something to help him? Please help us. My son was diagnosed with DIPG. We're hopeful, but we are realistic about the quantity of his life. He deserves quality of life. Can you walk us through what we can do? How can we help him? And how can you help us? My husband desperately needs access to medical marijuana. It's like I don't know him anymore. He's a combat veteran. He doesn't want to take any more medication. You have to help me, please. Every single story is unique and heartbreaking, and every story has a true Pennsylvania face behind it. Help us. Please help. Can you help? We believe at Campaign for Compassion that the best way to help every single patient that reaches out is to ensure that the medical marijuana program in Pennsylvania rolls out on time with top quality, affordable, consistent Pennsylvania-grown medicine. And we stand for all patients when we say that we will settle for nothing less. To delay this program by 1 minute is selfish, especially when it seems to be for personal gain. There is no way that anyone that truly believes in compassion and the strength of the patients they wish to serve would ever put their life in jeopardy. You win some, you lose some, and there's a second round of licenses, a second chance, and you need to do better next time. You don't risk lives in the meantime because we don't have the luxury of second chances. Right now, I'd like to introduce Christine Brand, a fellow C4C board member, the mom of Garrett, and a dear friend, discussing what could happen to Pennsylvania's safe harbor holders if this injunction is granted.
Good morning, and thank you, Senator Leach, as always, for spearheading this and always being supportive. There are only a few of us parents here this morning, but you don't see a lot of families here today behind these stories because in many cases their conditions prevent them from being here. They also, their caretakers are usually first line of defense 24/7, and they can't make it either. Another reason might be financially, whether it's because of lack of coverage for a nurse or someone else to care for the patient, or because of the doctor's bills or the prescription bills or the constant doctor visits. In reviewing the petition that was filed, the message that it sends really is we're thumbing our nose at you patients and you caregivers and the very people that this act was designed to protect. It's been about 1 year since the safe harbor regulations have been implemented, and there are approximately 300 safe harbor letters that have gone out for patients under the age of 18. The relief requested in the petition says we don't care about you. We want to win, and we'll win at any cost. We will file our 100-page petition, and we will spend tens of thousands of dollars. It sends the message this is more about greed than the genuine desire for the health of this Commonwealth's patients. The petition also disregards the irreparable harm, as touched upon by Kara, to these patients for every second that this program may be halted, and the devastating impact that the families of these patients will endure. By way of example, the potential damage for every seizure experienced by one of these children that have safe harbor letters cannot be ignored, and that damage is real. The safe harbor letters expire in May 2018. Without the protection of that safe harbor letter, the patients are going to be without access to safe and legal medical cannabis, and their families, caregivers, or the patients themselves may be subject to criminal prosecution. And this not only applies to those with the safe harbor letters, but for those adults over 18 and over who have been patiently waiting for the program to be operational. Of course, the parents and the patients want qualified medical marijuana organizations, the grower processors and the dispensaries, but to halt the entire program isn't appropriate, and it's irresponsible. The message that this petition filed by Keystone says is that the value of a permit and a win in their column is greater than the value of my son's life and those patients in Pennsylvania, and it's insulting. Thank you.
Thank you, and thank you to all of you for your eloquent statements.